Oh, when they gave me the call, I was there. I didn't even consider it. I just went in and got the shot.
I had two voices the whole time. I didn't want to get it, but I went through with it.
I was never like, no, I'm not going to get this.
And I didn't feel any reason to feel fear at that point.
I was waiting. That's the side that I was on.
I wanted to get out of Canada. I wanted to get on a ship.
I was planning my wedding. We wanted to go to Ireland.
I was about to be put on an unpaid leave of absence if I was not vaccinated.
We were all very afraid of catching it, so we were all on board with whatever they wanted us to do.
I am sick, the worst I've ever been in my life, and I haven't really gotten any help.
Sorry.
My legs started to tremble.
I started feeling itchy.
I'm really dizzy.
Got a racing heartbeat.
Rapid heart rate.
Just pound, thought I was having a heart attack.
Someone stabbing you.
Everything just felt really tight.
Like a 500-pound weight.
I've seen stroke, paralysis,
My body went completely numb.
Immune dysregulation.
Kidney problems.
blood clots.
Miscarriages.
Shortness of breath.
Hallucinations.
Myocarditis.
The most extreme menstrual event.
Something was really not okay.
What happened here?
Things were going wrong.
And I fell right on my face.
I made my peace.
Thought I was a goner.
I thought I was dying.
What about the future? What is this doing inside me and everybody else now? Why do the general public not know?
Why are we not warning people about this?
Why the push?
Obviously, they all know.
Why blocking those treatments?
Why are they hiding my story?
What is this truly about?
What's going on in society?
Because this isn't normal.
Makes no sense whatsoever.
And the thought of me giving my children that are all under 10 this vaccine is terrifying.
This line has been crossed.
How did it get to this place?
To me, it's a game that a 10-year-old could see through.
It becomes more real when it happens to someone that you know.
I'm scared to death still. Glad to be alive.
I'm not anti-vax. I had the vax. So I don't know where I fit in right now. I'm just trying to get healthy. That's basically it.
There's got to be a solution.
What about having a system set up for adverse effects? Why not that method?
Nothing heals the human body except the human body.
I'm looking at actual scientific studies.
Why aren't we trusting the most brilliant minds of the world?
They're treating this, but nobody's listening.
It's been removed. It's been blocked. It's not available.
They're taking away the best choice that we're seeing.
And we all need to start talking about it.
We need to wake up and figure it out.
They can work with the natural medicine just as effectively.
And that really changed things.
It's changed my life completely. It's all natural.
We're just not hearing about it on mainstream media.
Enough is enough.
Turn off the TV.
Get involved with the people around you.
I'm going to keep sharing my story.
I'm not going to stop fighting for what I believe in.
If you just ask why, that's when the divisiveness will end.
No, we don't comply.
I am not an anti-vaxxer.
I'm not an anti-vaxxer.
I'm not an anti-vaxxer.
Can't say no.
I am pro-choice.
I'm a fact finder.
I'm a truth seeker, and what I'm sharing with you is the truth.
This is not disinformation.
I am not disinformation.
This is not a conspiracy theory. This is real.
My story is real.
My story is real.
My story is real.
The story is real.
My story is real.
That's my story.
Please listen to my story.
Please listen to my story.
Please listen to my story.
I am real. I am a real person. I exist. You exist.
It's your choice. And that's being taken away from us.
I'm not misinformation.
Catch the 1 in a million type adverse effects until we have given sort of enough doses to enough people. So with regards to adults, I mean, we've given literally more than 10 billion doses of these vaccinations around the world. So we have a very good idea of exactly how safe they are, and they are incredibly safe. Like I said, in the States, they've already given out over 1 million doses to kids in the 5 to 11 year range. So we are keeping an eye on that data as well, and Health Canada and NACI will also continue to keep an eye on local data.
Is the formula itself different for kids? If it is 10 micrograms, why do we have to wait for a different delivery?
Yeah, that's a good question, and I don't believe that the formula is any different from the adult one. Now, again, I don't have access to the nitty gritty of that, but I believe
My name is Byron Fader. I'm 50 years old. I'm a builder. I'm an athlete, a long-distance runner, ultra-marathon runner. Work out regularly. I'm also an artist, sculptor. Physical fitness is my main passion. But right now, it's I just don't know. I don't. The body just is so delicate. Any form of stress, physically or mentally, I'm so fragile. And so I'm just walking this line, trying to push as best I can and do what I can. It was the best place I could be while I was sick, with my mind so troubled that doing this, that I've done it so much, it still was tough. The effects were so sickening that it didn't give me complete peace, but it gave me a bit of a home.
I'm here. I'm still here.
I was scared of the COVID. I was in the middle of a job in a lady's house, and I shut down the job because I didn't want to be in their house. Maybe I could infect them. I didn't know at the beginning.
Well, at the beginning, it was a bit nerve-wracking because I work in a homeless shelter. So, you're dealing with people that are in the public daily, not necessarily being able to cover themselves or protect themselves from what the pandemic said it was at the time, right?
You're hearing about, the cases in China, and at that point it seemed so distant that we didn't have to worry about it. But once we heard about cases in, North America and Canada, yeah, it was like everybody else. We were scared. We didn't know what to expect.
When we first heard about the global pandemic, reports were coming in from all over the world, and it sounded really dire.
I was probably more scared than most people. When I heard that it was a respiratory illness, I was very concerned for myself because I was like, well, I don't know how this is going to impact me and my asthma. But I definitely took it very seriously.
In my place that I rent, I actually moved out and into the yard, into a camper, and set up a little camp for myself to give space between me and my roommate, just because I wanted to do the right thing. I wanted to, the spirit that was being produced at that time was to help your neighbor, to your family, your friends, isolate, wear a mask, and so I took it very seriously.
And I vote and I do my civic duty, and so we were willing to listen to the 2 weeks to flatten the curve, We stockpiled toilet paper and bought rice, and we stayed home, right? We were really careful, sanitized.
Maybe washed my hands a little more than I probably used to. Bought a little more hand sanitizer, but I wasn't really predicting this sort of pandemic. So I guess it really didn't affect me at first.
At the time when the COVID was starting to pick up, it was people that were, sick already, elderly, weak immune systems.
One of the nurses came in and said, "Oh, get the shot," and how the pressure was on from the video and the radio, I should say, and the TV. You want to be able to hug your grandchildren and all this.
The media made it sound like it was so contagious and people were dying and the death was horrific.
There was a lot of fear. There was a lot of pervasive fear that was happening. We were afraid of getting sick, basically. Yeah, which made us afraid of everyone around us.
We were all very afraid of catching it. And so we were all on board with whatever they wanted us to do.
Oh, when they gave me the call, I was there. I didn't even consider it. I just went in and got the shot.
At the beginning, I definitely didn't want to take the vaccine. I wasn't planning on taking the vaccine. Work wasn't pressuring us.
I was about to be put on an unpaid leave of absence if I was not vaccinated.
I'm in my childbearing 8 years. I don't have a kid yet. I had just suffered a miscarriage. I wanted to wait to see other people get the shot and see if they were going to get pregnant, etc.
I was planning my wedding. We wanted to go to Ireland for our honeymoon. And at that point, international travel was going to mandate the vaccine. That's kind of, the big factor.
What made me was I wanted to get out of Canada. I wanted to get on a ship, and I just wanted to go see my family. before I went and started working back on ships, because on ships I'm gone 6 to 9 months, depending on what I take, right?
I was really reluctant to get it at first because I have a history of autoimmune issues, and even though I have all the vaccines from, high school for all the big diseases.
I mean, as a child, I received all my childhood vaccines. I received all the vaccines required of me to enter into nursing school and become a nurse. So no, I'm not anti-vax. I vaccinated my own child.
I was never like, no, I'm not going to get this. I was waiting. That's the side that I was on. Definitely not anti-vaccine. I've had every vaccine in my life that's ever been offered to me. Because I'm asthmatic, I would get a flu shot every year. Like I literally got a flu shot every year up until 2019.
I didn't want to get it at all. My mother, 11 years ago, dropped to the ground, paralyzed from the neck down, and has been on a ventilator ever since after receiving the H1N1 vaccine.
The longer that I researched and looked at things, I thought, no, I'm not going to get it. I'm going to wait it out, see what happens, see if anybody grows fins or not. I kept saying that, but not very many people have a sense of humor these last 2 years.
And I would go on my phone, and I swear, like every time I opened it, it was a new friend of mine posting that they had gotten their shot and they had their little sticker. And I'm a people pleaser, so I like to fit in. So that started to get to me. I was like, oh no, like, am I the only person that's not getting this?
That's human nature. People don't like to be the outsider. People don't like to be, the one that doesn't fit in. So that's a tactic to get people to become vaccinated.
I should get the shot. It was like a mixture of the peer pressure of like everyone else doing it, and then my nurse friend telling me that I would end up very sick if I got COVID.
Just responding to the pressure from the TV and radio. That's all.
I have elderly in-laws and elderly parents, so I figured I'm healthy. There's nothing wrong with me. I've got no underlying health conditions. So the risk should be minimal, and that's what you're told.
I'm anaphylactic to all aspirins, ibuprofens, amoxicillin, penicillin, tetracycline, sulfur drugs. I didn't know what was in it, and I had no idea, so I thought, I'm not going to take it. I don't want to have to end up in the hospital or die on my way to the hospital. So my doctor said it was fine for me to take. So I trust my doctor,
And I didn't feel any reason to fear at that point. Now I realize I should have been more alert.
Literally walking into the building, I had crazy anxiety about it.
I didn't feel right. My instincts were telling me no, but my mind was telling me yes. My mind, what I've heard in the news, and I just thought, I got to do the right thing. This is what you do.
I went down to the vaccine clinic. I didn't want to get it. I was, I had two voices the whole time. I didn't want to get it, but I went through with it. Afterwards, I wish that I hadn't got it. I still wish that I didn't have it,
My children's father had a very severe adverse reaction to the Pfizer vaccine a few months ago. And we were waiting to see if his was life-threatening before I got mine. But that didn't happen before my mandatory need your first dose date for work by came. So I ended up getting the first dose, and this happened.
He said, you'll get a headache, which is true, and you'll be tired, and you'll have a sore arm. But then, it'll be fine. Okay. So, when he said it, that's an imperative, that was the wording, imperative, that I take it. So I was, okay then, I guess it's safe for me to take.
There was a bunch of lineups, and then I sat down with a nurse, and she talked to me. I think there was something she gave me to read, but he didn't. It was basically, you went from a line to another line, then you sat down.
There would be no information on any kind of reaction. Oh, you'll be fine. That's what she said. Most people don't have any trouble. So that's the only kind of informed, non-informed consent that we had. It was just that you'll be okay.
I expressed my hesitations to the health nurse that was there, and they assured me that no, there's nothing to worry about, and we haven't seen any, these ones are safe. And
no, they did not tell me at all what some of the side effects. The only thing that was stated, and they stated that to my son, who doesn't really like shots, pretty much said the only thing is your arm will be sore.
And at that point, you never think, oh, should I ask if there's some kind of repercussions or some effects? You never think of that, because you sent it at that point. Even still, stupidly, I was trusting these people that had medical certifications. I don't know if I do anymore, but
you're doing the right thing. This is great. This was all on that level. There was nothing. I didn't feel any questioning at all.
I'm an RN. I've been an RN for about 21 years now. I work in a specialized area, cardiac.
I'm an occupational therapist, registered holistic nutritionist, and I'm a team lead with the Canada Health Alliance.
I'm the clinical director of Genoa Integrative Health and Wellness Center, the only sole phototherapy or photobiomodulation clinic in BC.
I'm a master of holistic health. I worked in natural healthcare and medicine since the 1980s.
I'm here because I don't believe in the mandates, and I am really, really scared of this vaccine and what I've seen on my unit from this vaccine.
Evidence-based practice is what we are supposed to be doing. As well, we're supposed to be doing no harm. And both of those factors appear to be missing right now.
The stress that we're seeing, and as I mentioned, I work with practitioners across Canada and several in the States as well. I got one phone call about 3 weeks ago from a practitioner up in Vancouver Island, and she said, what is going on? What she's seeing in people: immune dysregulation, liver dysfunction, stress levels off the charts. And I'm hearing this from every practitioner that I've spoken to. People are coming in stressed, people are coming in agitated. Physiologically, stress stresses the adrenals. The adrenals put out more cortisol. Cortisol affects our insulin levels, our blood sugar levels, everything. And what these practitioners are seeing is the stress showing up in cardiovascular disease and neurovascular diseases in every aspect of the body.
We're seeing this huge bump now in people that were predominantly healthy before, no real underlying conditions, people that have been diagnosed now with COPD 2 months post-vaccine. Well, they never had lung problems before. We're seeing people with myocarditis, which is an inflammation of the heart. We're seeing post-concussion type symptoms in people with having now kidney problems. They're having these weird bouts of fatigue and shortness of breath. We're seeing the brain fog. We're seeing the cognition impairments. We're seeing the chronic fatigue. But we're also seeing these incredible boosts in overall inflammatory processes.
Since the rollout of the vaccines, I have witnessed, just in my little unit, stroke, blood clots, paralysis. This one fellow came in with some weird jerking, coughing movements in his chest that nobody could explain, almost like spasms.
Probably about 6 hours in after the shot, my legs started to tremble. I was just sitting in the boat and I was trembling.
I thought, how come I'm really dizzy? And I just feel sick.
I started feeling itchy, palms, that.
Within 20 minutes of that, I had a sore throat.
At the 10-minute mark, I started getting like a racing heartbeat. It was like, I felt like it was pounding out of my chest. It was like super fast and super loud.
About 5 minutes after I left the facility, I'm in my car driving, and I had blurred vision. I couldn't see the road. I swerved over to park.
I almost felt like I had taken some sort of drug or alcohol or something. Like it was like a haze.
I'm still having problems with my memory. That's why I'm trying to close my eyes a lot, because The one thing is I have a foggy head, and it's been foggy since the 23rd night, and that's the night the first night I started to show things.
Couple hours later, I had full-blown muscle aches, this foggy headache that was just, it's really indescribable. It's like, I don't even know. It was just, something was really not okay with it.
I know that I was stuttering and stammering because my speech was not very good and my vision not very good either, but of course I wasn't looking out around much.
I had slurred speech. I had a headache.
And all of a sudden my vision started going blurry, like just a little bit. And then I started kind of freaking out, and I was like called over a nurse, and I said, I don't feel good.
But I started to get this really weird, like metallic taste in my mouth, and everything just felt really tight, which I recognized from, I get really bad inflammation and pain from autoimmune disease, and that's what it felt like. Everything was just locking up, like everywhere.
Rapid heart rate, not pain, but just really bad pressure in my chest, unable to breathe.
I honestly thought I was having either a stroke or an anaphylactic shock.
The next couple days, the legs trembled more. I started feeling a little bit of nausea. I started feeling a little bit of dizziness. And by day 4, I couldn't take it anymore. I was starting to really shake. I sat on the shore, and everything was spinning and moving. Like you'd turn your head and things would move, and things were going wrong.
I was right into outer space there with this dizziness, and I couldn't even see well by that time. I guess it struck me, and I just slipped and fell and broke my hip.
And then 3 hours later, I lost all motor function on my left side of my body, went completely numb, like a sleeping, tingling sense.
I started to get tingling in the legs and the arms. Probably a half an hour after that, my legs were completely numb. I had urinated myself and not known it. Didn't know what was going on. Didn't know if I was going to pass out. Couldn't really take a step without wondering, am I really actually taking a step, and is my foot touching the ground?
I had nausea, I had shortness of breath, rapid, like that, and started crying, and then hit the bed, hit the sheets for 12 hours.
And then when I woke up the next day, I got out of bed to get up, and I fell right on my face. So I knew there was something wrong then.
My guts and my whole demeanor, I said, I'm just losing my chi here. I'm just going downhill so fast. What happened here?
I couldn't even walk up a flight of stairs. I was like, what the hell? I'm like, this is not normal. Something is off. I felt like I had literally like a 500-pound weight on my chest. Like I just felt like I couldn't get a full breath in. It just felt uncomfortable. When I laid down, it was worse.
I shook more. I had tremors. I started having a vibration in my chest, like your phone is on vibrate and it's in your chest. Just a really bzzz going, wouldn't stop.
The pain just kept coming and coming and coming in waves, and it was sharp pains, like someone stabbing you. And that pain would like a ripple effect over your whole body. It would just go, let's say it was my left thigh that would hurt. I would get a shooting pain that would ripple to my entire body all the way up to my head.
Then I started spotting, like my menstruation, I started spotting. And then I had a 14-day period, which was the most extreme menstrual event that I've ever had in my life, like times 100. And it scared the crap out of me. It made me feel like if I had been of childbearing age, pregnant or wanting to get pregnant, that something may have been in danger, right?
And then my mind started to go. I started to get constant fight or flight mode. I just couldn't shut it off. There was no place in the house I could hide. There was nothing I can do. I found myself in the middle of the night trying to do drywall in the laundry room just to focus because my mind was totally gone. It was absolutely terrifying. I've never been in that position.
For the 3 or 4 days at least after that, night and day, I kept having hallucinations. I thought, this is how people feel just before they commit suicide, because you're like in a great big bag of blackness and you can't seem to get out. And that was so scary. I don't know if I'm ever going to even want to recall it again. Even thinking about it now makes me upset.
It was pretty scary that moment. I really thought I was a goner.
That night I had the worst sleep of my life. I thought I was dying.
I thought I was dying, 100%. I thought I was dying. I made my peace.
And I remember saying to my daughter on the phone, I just feel like I'm going to die.
My girlfriend called an ambulance. I thought I was having a heart attack. My heart would just pound. My blood pressure skyrocketed, heart rate, and my mind was totally gone.
And then there's people who've come in who were previously healthy, never had a health issue, and now they've come in with heart attack. I saw a couple young people come in with myocarditis, that's inflammation of the heart. I think one of them was 25, one of them was 29.
Ended up in the ER. I spent the entire day there. While I was in the waiting room in the ER, I was sitting across from one of my best friends and her 16-year-old daughter, who I got my dose Wednesday and she got her dose Friday, and she had the exact same symptoms as me.
I had never experienced chest pain in my life before. Again, I'm 30 years old. I'm young. I'm aside from having asthma and allergies, I was very healthy.
All of a sudden, I'm really sicker than I've been in my whole life. Never anything like this. And I am a healthy person. I eat healthy. I'm physically active. And this just took me down.
I was diagnosed at the hospital with pericarditis and pericardial effusion.
And they diagnosed me with left bundle branch block.
I seen a doctor first thing. They recommended I get blood work, a chest x-ray. The blood work came back, my D-dimer levels were high, so that could have possibly indicated a blood clot. So they sent me for an emergency CT scan to make sure I didn't have a blood clot in my lungs.
CT scan, brain, heart, my blood work showed up high troponin, which is an enzyme that's produced when you have a heart attack. And so I stayed in the hospital, and they had me hooked up to all the wires, and they kept coming in my room and racing in and putting these new wires on because my heart was showing irregularities.
The next morning, I woke up and I thought I was having a heart attack. All the stress started coming. The nurse that was in there, she was amazing. She got like panic mode. Everybody started running, getting everything. They hooked me up to EKG. It showed that I had either a small heart attack or a stress attack.
And they observed fasciculations all over my body, under the skin. You just see these little twitches and movements. It was very, very uncomfortable. You couldn't sleep because the legs hurt so much. And all these things are common between all of us. All of us that I talk to in the adverse effects. The symptoms are the same. Some symptoms, I couldn't take a shower. Hot water would destroy me. Any bit of hot water and I would just be dizzy and on the floor and couldn't do anything. And that's common between all people. And then I couldn't shut my eyes because everything would spin too much. I have to open them immediately. And I've had friends who can't open their eyes. And then my pupils were so dilated that out here was so bright and so painful. And now I couldn't read I get up, I can't read my phone for days. Can't see it. It's all blurry. All my eyes went. And now I look at my eyes in the mirror, and still to this day, my eyes don't look like my eyes. The whites and the blues of my eyes are not my eyes. They're cloudier and dirtier looking, and they got more red bloodlines through them.
Even to this day, my vision is not as good. My memory is certainly not as good. And I'm only now, because of things that I've been doing to counteract it, is my mind starting to clear. But I would say, I think from this thing that my brain, a few brain cells were permanently damaged. And I especially feel that in the relationship of that awful nightmarish aftermath of hallucinations, that was a point where my head will never be the same.
I end up going and getting CT scan done. The neurologist came and see me, and his name was Dr. And he said, he started, first he started doing the normal thing. The vaccine's great. A vaccine does help a lot of people. And I was like, okay, fine. So then he starts talking to me a bit more. And I said, well, give it to me. Is it the vaccine injury? Is it from the vaccine? He goes, people have been having problems with this. I'm not going to say they haven't. With any vaccine, this is what happens in some cases. And yes, I think this is from the vaccine with you. And it's one of the worst I've seen.
They initially thought it was transverse myelitis. It's where the vaccine attacks the myelin of the spine, which is the protective sheath, I guess you could say, to all the nerves within your spine. They had told me that transverse myelitis was one of the rare, according to them, side effects from any vaccine, especially the COVID vaccine.
So I was there for 4 days. At the end of the 4 days, my doctor had come and told me he'd release me. And so I went to his office and he gave me basically some sleeping pills and crazy people pills and sent me home.
After spending the entire day at the hospital, I actually never did see a doctor again. A nurse came out and took my IV out and told me they're chalking it down to asymptomatic COVID, which is ridiculous because I had symptoms. And my COVID test came back negative.
But every time a nurse or a doctor came in, I would say, this is how this happened, and I feel so bad, because I was looking for therapy from the mental health people in the hospital and anybody that would listen to me, because it was such a scary experience. It was just out of this world.
They've seen it. They've seen multiple cases. When I was admitted to Providence, I was the 7th case they've seen that week with transverse myelitis. And that's the rarest of essentially acute issues that they had seen recently. There were other issues, but I was the 7th.
The doctor comes in, says, hi, I'm Dr. So-and-so. We can't find anything wrong with you. And so we're changing your diagnosis from the vaccine injury to unknown. And I'm like, whoa, wait a minute. Like, what? And she goes, yeah, we can't find anything, so it's unknown. I said, well, Dr. told me the other night that it was from the vaccine. And she goes, yeah, we had a meeting with the doctor, and he knows now that it's unknown. I was like, okay, this is crap. So at this time, the nurse who's, visibly right beside me, visibly shaken, she starts trembling a bit. And I know she's not scared of whatever is happening. I know she's mad about this. It's just a sense or you can feel, right? And so the doctor, I said, are you serious? Like, how am I in the hospital? What is this a coincidence? And she's like, coincidence. There you go. And I'm like, well, this is ridiculous. She goes, I'm not going to sit here and argue with you. Just get yourself ready. We're discharging you. And I was like, whoa.
The doctor comes back and I said to her, I'm like, well, do you think it's because of the shot? And as soon as I brought up the shot up, it was like I had touched the most taboo topic of all time. And I was like, wow, I could tell that the emergency doctor literally did not want to talk about it. She didn't want to blame it. She almost seemed offended that I even asked that.
It's not discussed much on where I am, I'll be honest. Sometimes just in their history, it might be mentioned that the patient received the COVID vaccine, a few days ago, and now they're here with this. And it's not that they're calling it a vaccine injury, but they say it might be related. Yeah, there seems to be a reluctance to say that anything was caused by the vaccine. I think the first one being that if they label these reactions as from the vaccine, there will be a lot more vaccine hesitancy. And from what I understand, doctors are being told that they are to promote this vaccine and they are not to give anybody any reason not to not want the vaccine.
I verbalized it the first time in the hospital, the first time I was there. I got the vaccine on this day. I started twitching that day, and so to me it was 100% the vaccine. Never had anything like